Let me ask you something personal. When was the last time you actually stopped and thought about your blood sugar? Not because you were diagnosed with diabetes, but because you wanted to know if you were heading in that direction before it became a bigger problem. Because here's the truth that most people never hear until it's too late. Type 2 diabetes almost never just shows up. It builds quietly, slowly, sometimes over years, and there's a stage before it that millions of people are living with right now without even knowing it. It's called prediabetes. And if I can catch it early, if I can help you identify the signs today, then this video might be one of the most important ones you ever watch. So stay with me, because in the next few minutes, I'm going to walk you through a simple, practical 1-minute self-assessment that you can do right now, wherever you are. No blood test required, no doctor's office needed, just honest answers to honest questions, and the knowledge to know what those answers mean for your health. Before I get into the test itself, I want to ask you something, and I genuinely want to hear from you. Drop your answer in the comments below. Have you ever had your blood sugar tested? Whether it was at a routine checkup, at a health fair, or even at home with a monitor, have you ever actually seen that number? Because you'd be surprised how many people haven't. And that's not a criticism, that's just reality. Most of us don't think about blood sugar until something goes wrong. But that's exactly what I want to change today. So let me know in the comments, yes, I've been tested, or no, I never have. I'll be reading your responses. Now let's talk about what prediabetes actually is, because I think a lot of people misunderstand it. Prediabetes is not a life sentence. It's not a diagnosis that means you're on your way to full diabetes no matter what. It's actually a warning window, a moment in time where your blood sugar is higher than normal, but not yet high enough to be classified as type 2 diabetes. And that window is genuinely powerful if you use it. Studies show that people who catch prediabetes early and make targeted lifestyle changes can reduce their risk of progressing to type 2 diabetes by up to 58%. Some people reverse it entirely. So this is not a conversation about fear. It's a conversation about opportunity. But here's why it's so easy to miss. Prediabetes is largely silent. Most people feel completely fine. They're living their lives, going to work, sleeping, eating, doing everything they normally do. And meanwhile, their blood sugar is quietly sitting in a range that, over time, starts to put stress on the heart, the kidneys, the nerves, and the eyes. The damage can begin long before any symptoms appear. That's the insidious part. And that's why I made this video. Because I believe you deserve to know where you stand before a doctor eventually tells you the hard way. So here is the 1-minute self-assessment. I'm going to walk you through 8 questions. For each one, I want you to be completely honest. Not with me, but with yourself. Nobody is grading you. There are no right or wrong answers in terms of judgment. There's only the truth about your body and what that truth might be telling you. Question 1. How old are you? I know that sounds simple, but age is actually one of the most significant risk factors for prediabetes. If you are 45 years old or older, that places you in a higher risk category. The pancreas naturally becomes slightly less efficient at producing insulin over time, and decades of dietary habits can compound that effect. If you're under 45, that's great, but don't stop here, because age is just one piece of this puzzle. Question 2. What is your weight situation? Are you currently carrying extra weight, particularly around your midsection, your belly and waist? This is important because excess weight, especially abdominal fat, is directly linked to insulin resistance. Insulin resistance is essentially the engine behind prediabetes. When fat accumulates around your organs, it interferes with insulin's ability to do its job properly. Your body starts producing more and more insulin to compensate, and over time, that system starts to break down. If your waist circumference is greater than 35 inches for women or greater than 40 inches for men, that's a flag worth paying attention to. Question 3. How physically active are you on a typical week? Be honest here. Are you getting at least 150 minutes of moderate physical activity, things like brisk walking, cycling, or swimming, each week? Or are you mostly sedentary, sitting at a desk for most of the day, not getting much movement in? Physical inactivity is one of the most modifiable risk factors for prediabetes. Exercise helps your muscle cells use glucose more efficiently, which naturally helps regulate blood sugar. If you're not moving much right now, that's something you can start changing today. And it doesn't have to be dramatic. Question 4. Do you have a parent, sibling, or close blood relative who has type 2 diabetes? Genetics play a role. Not a destiny, but a role. If diabetes runs in your family, your risk of developing prediabetes is meaningfully higher. This doesn't mean you're doomed. It means you need to be more proactive and more intentional about the lifestyle choices that lower your risk. Question 5. Have you ever been diagnosed with gestational diabetes, meaning diabetes during pregnancy? Or if you're a woman, have you given birth to a baby weighing more than 9 pounds? Both of these are significant markers that your body has had difficulty regulating blood sugar in the past. Women with a history of gestational diabetes have a substantially higher risk of developing prediabetes and type 2 diabetes later in life, and that risk doesn't disappear after the pregnancy ends. Question 6. Do you have high blood pressure, or are you currently taking medication to control your blood pressure? Hypertension and prediabetes often travel together. They share many of the same root causes: poor diet, inactivity, excess weight, chronic stress, and when both are present, the combined impact on cardiovascular health becomes significant. If you have high blood pressure, you and your doctor should absolutely also be keeping an eye on your blood sugar. Question 7. Have you been told that your cholesterol levels are abnormal? Specifically, that you have low HDL cholesterol, which is the good kind, or high triglycerides? Abnormal lipid levels are another hallmark of insulin resistance. When insulin isn't working efficiently in your body, it affects not just your blood sugar, but also how your body processes fats. High triglycerides combined with low HDL is a pattern that frequently shows up alongside elevated blood sugar, and it's something that a simple blood panel can reveal. Question 8. In the past few months, have you noticed any of these symptoms? Unusual fatigue that doesn't improve with rest, increased thirst or frequent urination, blurry vision that comes and goes, slow healing cuts or bruises, or a feeling of tingling or numbness in your feet or hands. Now, I want to be clear here. These symptoms are more commonly associated with type 2 diabetes than prediabetes, because prediabetes is usually silent. But if you're experiencing any of these, that's your body sending you a message, and I want you to take it seriously. Don't brush it off. These symptoms deserve a conversation with your doctor. Now let's talk about what your answers might mean. If you answered yes to 3 or more of these questions, I want you to hear this gently but clearly. You may be at significant risk for prediabetes, and you should speak with your healthcare provider about getting your blood sugar tested. The test is simple. It's called a fasting glucose test, or an HbA1c test, and it gives you concrete numbers so you're not guessing anymore. Knowledge is power, and getting that test is the single most important thing you can do if you're in this category. If you answered yes to 1 or 2 questions, your risk may be lower, but that doesn't mean you get to skip the conversation. Risk factors have a way of accumulating over time, and the habits you build now, the food you eat, the way you move, the stress you manage, those habits are writing your future health story. This is a great moment to start making intentional choices, and if you answered no to most or all of these questions, I still encourage you to keep these risk factors in mind as life changes. Body weight can shift, activity levels can drop, family health history can emerge, and annual checkups are a simple, easy way to stay ahead of anything that might be developing. So what do you actually do if you suspect you might be pre-diabetic? Let me give you the most powerful, evidence-backed actions you can start taking immediately. First, move your body. Even a 30-minute walk 5 times a week has been shown in large clinical trials to dramatically reduce the risk of progressing from prediabetes to diabetes. You don't need a gym membership, you just need to start. Second, take a hard look at what you're eating. Not to go on a crash diet, but to reduce refined carbohydrates, added sugars, and ultra-processed foods, and replace them with vegetables, lean proteins, whole grains, and healthy fats. These changes don't need to be extreme to be effective. Even modest, consistent improvements make a measurable difference in your blood sugar levels. Third, if you're carrying extra weight, Even a modest 5 to 7% reduction in your body weight can have a clinically significant impact on your insulin sensitivity. That's not a dramatic transformation. That's just meaningful progress in the right direction. Fourth, reduce your stress and prioritize your sleep. Chronic stress and poor sleep both raise cortisol levels, which in turn raises blood sugar. This part often gets overlooked, but it matters more than most people realize. I want to leave you with this. Prediabetes is not a failure. It's not something to be ashamed of. It's a signal, one that your body is sending you with enough time to act. And the fact that you're here, watching this, asking these questions, thinking seriously about your health, that already puts you ahead of so many people who aren't paying attention. You have the ability to change the trajectory of your health right now, not someday, today. So please, take what you learned in this video, share it with someone you love who might need to hear it. And if even one of those questions raised a concern, make the appointment. Get the test. Know your numbers. Because you deserve to live a long, healthy, energetic life, and this is how it starts.